Do you think Ayurveda learning is difficult? Do you think Roga Nidana learning is difficult? What is the opinion of the expert in the field of Ayurveda as well as Roga Nidana? This is the topic of discussion in this particular video. Dear community members, press the like button and spread this particular video to maximum number of true Nidana learners. At least one true Nidana learner, so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be pitching with the right information at the right time for the right purpose. This is the second from the series from quote from the experts or quote from the veterans in the field of Ayurveda. Among that, one of such experts who is considered to be the teacher in my undergraduate studies, according to him, Prof B V Prasanna, millions of milestones are to be achieved in the field of Roga Nidana. So several studies are going on in the field of Roga Nidana from the past 3 or 4 decades or more. In the even the after that particular amount of the research is going on in the field of Roga Nidana, it is being said millions of milestones are being yet to be achieved in the field of Roga Nidana. So for this, I am giving my interpretation. Whenever if you think about why so this particular millions of milestones have to be achieved in the field of Roga Nidana. So whenever if you think about it, the first and foremost cause, that is what we can say, the inadequate Sanskrita knowledge among the researchers. This is one of the primary reason we are going to say for this particular statement to be made. Let us say, for example, the term sexual intercourse. It is being mentioned in Ayurveda with different terminologies, such as Vyavaya, Stri Seva, Dara Abhigamana, Gramya Dharma, Maithuna, Dara Agamana, Shukra Ativartana. So these are the different terminologies for the sexual intercourse. Of course, Shukra Ativartana, that may be even the other means also Shukra Ativartana may take place, but the most commonly encountered the terminologies in Sanskrita for the sexual intercourse is this. So let us say one more example for this, that is Langhana. The word meaning Langhana refers to the measures which are responsible for the lightness of the body. That means which is actually reducing the heaviness of the body itself. For that, what are the different means that can be achieved for the Langhana effect that is mentioned in Charaka Samhita as 4 types of Samshodhana. That is Vamana, that is therapeutic emesis, Virechana, therapeutic purgation, and the Basti, that is the enema, and Nasya. So these are the Langhana effect producing Samshodhana therapies. Apart from that, the other means where we can able to achieve Langhana, that could be Pipasa, that is the making the person to have the thirsty feeling. That means giving the less quantity of water or fluid. Maruta, exposure to atmospheric air. Atapa, exposure to the bright sunlight or broad sunlight. Pachana, the consumption of the medicines which are considered to be responsible for the Amapachana effect. Then Upavasa, that is doing the fasting or starvation as such. Then Vyayama, that is the exercise. These are the different ways where the Langhana effect can be achieved. But the most of the occasions, what the Langhana aspect that is very limited to fasting itself. This is what is considered to be the area where we have to go for the this research as such. Regarding the further information in relation to Langhana, so that is, first of all, we have to know about what is the actually the state of the illness as such. Based on that particular state of the illness, what kind of the Langhana may be necessary. For example, if the person is having the Kapha Prakopa in Amashaya, the Langhana has to be done to be different. If the person is having the Kapha Prakopa in Janusandhi, the type of Langhana has to be followed may be different. In case of the what kind of the Langhana is preferred in case of children, if they are suffering from any kind of the kapha dominant diseases. In case of elderly people, what kind of Langana has to be adopted? Is it Vamana Virachan or Basti as such? And what is the information of Langana? It's in the understanding in current era. This is also the area where one has to go for the much more deep understanding. What kind of the Langhana has to be preferred in case of Kapha Prakriti individuals, in case of Pitta Prakriti individuals, and how to plan Langhana therapy in case of Vata Prakriti individuals, how to plan Langhana diet, whether it can be prescribed or Langhana in relation to regimen can be done. If that can be done, what is the method or what is the procedure to be followed in that particular situation? How to decide the Langhana of the Langhana administered to the patient is adequate. How to decide the Lakshana of Langhana therapies, whether is it adequate or not, how to decide that. And what is the relation between the Bahya Srotas and Abhyantara Srotas when Langhana is being administered? What may be the impact on the mouth, on the nose, eyes, ears, the urethra, vagina, anus, breast, etc. Impact of those Langhana effect on the Bhakya Srotas, impact of this Langhana therapy for Abhyantara Srotas such as Pranavaha Srotas, Annavaha Srotas, Udakavaha Srotas, Rasavaha Srotas, Raktavaha Srotas, etc. So that has to be documented properly. How the source of the entry of pathogen that is being decided, that is leading to the impact as such, and how to decide the number of pathogens entering into these Bahya Srotasas or Abhyantara Srotasas, and how to decide the virulence of the pathogens entering into the body and their impact on the Langhana. That can be the one more area where the research can be done. Impact of the Langhana therapy in terms of the alimentary canal compartment, what we can see the Abhyantara Srotas as such, intravascular compartment. So that is the compartment where the movement of these nutrients and pathogens, they are going to take place in the blood vessels as such. Interstitial compartment, that is the area of the compartment where the group of the cells are being situated. And impact of Langhana on intracellular compartment, that is the impact of Langhana inside the cells. How to decide, how to know about the impact of that. That's another area of research as such. How to evaluate the Langhana based on the Ayurveda parameters as well as Western parameters as well as based on the research parameters. How to statistically analyze the Langhana effect based on the Ayurveda principles and based on the Western principle sectors. So these are the certain area where we can work on the Langhana aspect. As far as the clinical research is concerned, this is the small flowchart which is considered to be the categories of research, specifically clinical research, which may be either qualitative research or quantitative research. When you think about the different terminologies, the qualitative research as well as quantitative research, they are again of two categories, primary research and secondary research. When you think about the primary research, it is nothing but the research conducted by the primary researcher. He himself does the research, and based on that he will be coming to the conclusion from that particular primary research. So that is one category. Secondary research, wherein the research will be done by somebody else, and the researcher is going to do or take those documents or data and interpret their own findings based on those documents. That is categorized under secondary research. Whereas qualitative research is the one which is actually responsible for the focusing the understanding human experiences or behaviors or social phenomena through collection and analysis of non-numerical data such as text, audio or videos, etc. For example, survey studies. Survey of an individual of a hypertension in a particular locality. Survey studies of the diabetic individuals in a particular locality. Survey of an individuals who are actually consuming the samosa only, who are consuming the dahi only, who are consuming. So in that way, so conducting the research in that particular way, that is survey studies, observational studies. For example, so they conducting the relation between the Dadhi Sevana and Tamakashwasa, conducting the research on the people who are residing in Shita Sthana and Tamakashwasa. So in that way, the observational studies, all these are considered under qualitative research. Whereas quantitative research, in the sense that is the research which is mainly focusing on the collecting and analyzing the numerical data to identify the patterns and make predictions and test the causal relationships. For example, efficacy of ashwagandha or the effect of langhana therapy in amavata, efficacy of ashwagandha in vata vyadhi, or otherwise the impact on hemoglobin parameters pre and post test. So that is what we can say the considered to be the quantitative research, wherein we are going to talk in numerical data, that is numbers. Next thing, that is the non-causal research. So the term non-causal research refers to the research that do not manipulate an independent variable or randomly assign participants to conditions. So that is, so here the randomization technique, wherein each and every variable is having the what do you say, that the is having the option to enter into the studies. So in that way, non-causal research. So here, that is the different ways of the causal research, that is cross-sectional studies, wherein we are going to interact with the patient or client only once. Correlational studies, to know about the relation between the two variables. Observational studies, to have the interaction with the samples frequently to identify the relation between the cause and effect as such. So that is considered to be the non-causal research. Whereas causal research refers to the research to identify the cause and effect in between the two or more variables. For example, the relation between the Dadhi and Amavata relation, the relation between the Rajas and Tamakashwasa. Coming to the diagnostic research as such. So here, the possible area where we are going to look into that as such, that is how to set the diagnostic criteria for a diagnosis of the disease X. For example, Amavata, how to set the diagnostic criteria based on the Ayurveda principles. Angamardo ruchisthrishna alasyam gauravam jara apaka shunatangaram amavatasya lakshanam. These are the lakshana that are being mentioned for Amavata. how to set the diagnostic criteria for each of these. Maybe the one initial stages as such, how to frame questionnaires for the diagnosis of the disease X in Ayurveda, how to frame the questionnaires in relation to these, the Lakshana, Samanya Lakshana of Amavata. So that is the coming under the purview of diagnostic research. How to set the demographic parameters. So regarding the age criteria, gender criteria, location criteria, etc., how to set the demographic parameters for the diagnosis of disease X, for example, Amavata. As such, how to set the materials and methods in the diagnostic research, how we are going to select the samples, how to know about the sample size, etc. So that is how to select the prevalence rates as such. So materials and methods, in where from which particular clinical setting we are going to take the patients of Amavata, etc. So that is considered to be the next criteria that has to be developed in cases of the diagnostic research. Regarding the prognostic research. So here prognostic research refers to the setting the prognostic parameters. For example, in terms of the dosha level, whether the person is having only one dosha prakopa or dvandva dosha prakopa or all the three dosha prakopa, or is there any involvement of rajas and tamas is there or not. Regarding the dushya level, which particular dushya is being afflicted, whether is it one dushya or two dushya or more dushya. Srotas level, which are the srotas that are being afflicted, whether is it bahya srotas afflicted or abhyantara srotas is afflicted. If bahya srotas is afflicted, the number of bahya srotas affliction, and abhyantara srotas, the number of abhyantara srotas affliction. Agni level, what is the status of Agni, status of Jataragni, status of Dhatwagni, status of Bhutagni, Ama. So which particular Ama is responsible for the disease manifestation, whether is it present in the Mahasrotas itself, or whether is it present in the Dhatwagni level, or whether is it present in the Bhutagni level. Roga Marga, which particular Roga Marga affliction is being present, whether is it Abhyantara Roga Marga affliction, or Bahya Roga Marga affliction, or Madhyama Roga Marga affliction, and progression of the disease in an individual. All these based on the nature of the Lakshana that are being produced by an individual. All these are helpful in predicting the prognosis of the disease. So all these are categorized under prognostic research. Regarding the interventional research, in the sense we are going to give some kind of the medication, maybe some kind of the, what do you say, that the what do you say, that opinion in relation to the diet and regimen, what may be its impact on the patient as such. So that is the following points that are being necessary by looking into interventional research. How to decide the intervention for the disease, whether is it the classical preparation mentioned in the Ayurveda textbooks or newly developed drug. Both are requiring different ways of interventional researches. How to plan the intervention or the procedure, whether is it the oral medication or whether is it some kind of the panchakarma treatment as such, and impact of these oral or panchakarma treatments on the patient assessment, that has to be included in this particular interventional study, and identify any kind of the adverse drug reaction and determining the possible cause of the outcome of the intervention. Regarding the proportion of the herbal and mineral drugs in the intervention, and interpretation of herbal drug interaction in the body, that can be what we can say pharmacokinetics and pharmacodynamics of the drugs as per the Ayurveda fundamentals. In other words, mode of action of a drug as per the Ayurveda fundamentals. All these are categorized under the umbrella of interventional research. Coming to the etiological research. So here the history taking is considered to be very, very important. And based on the history, we are going to look into the degree of extent of exposure of the etiological factor in the diseased individual. How to identify the confounding factors which may be responsible for the disease manifestation. How to eliminate those confounding factors. And how to establish the cause and effect relation between the two variables. So these are the points coming under the umbrella of etiological research. To sum up, as per the veteran expert, Ayurveda expert, Prof B V Prasanna, he said the millions of milestones are to be achieved in the field of Roga Nidana. He says, after 40 plus years of academic experience. So based on that, so my interpretation goes like this. Samskrita should be learned with deep understanding, as all Ayurveda textbooks are originally seen in Samskrita language. And the learning Samskrita language is not difficult because most of the Indian languages are having the affinity or the similarity with that of the Samskrita language. That is the reason we can able to learn the Samskrita easily. And proper blending of Ayurveda and Western research methods should be adopted. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.